probably heard of these 5 myths about type 2 diabetes. Today, I'm going to go through these individually and we're going to debunk them, and I'm going to give you the facts about type 2 diabetes. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician who specializes in treating metabolic conditions such as type 2 diabetes through lifestyle optimization, weight management, and utilization of highly safe and effective medications. And I do this primarily through my telehealth clinic called Missouri Metabolic Health, where I serve adult patients all throughout the state of Missouri. Myth number 1 is that only people who are overweight or obese have type 2 diabetes. And this is not true. Having excess weight can put you at higher risk for developing type 2 diabetes, but this is a multifactorial disease, meaning that there are many factors that can contribute to the development of type 2 diabetes. Excess weight is one of them. Genetics plays a big role. Lifestyle, that can include stress levels, how often someone is sleeping, if they are exercising or being physically active throughout the day. All of that contributes to the development of type 2 diabetes. We're also learning new possible contributing factors such as exposure to things in the environment, such as microplastics or other pollutants in the air or in the food that we eat or things that we come in contact with on a day-to-day basis. And this is an exciting area of research that we are hoping to learn more about in the near future so we can take those precautions and prevent the development of type 2 diabetes. Myth number 2 is that once you are diagnosed with having type 2 diabetes, then you can no longer eat carbohydrates. There is nothing that you have to cut out of your diet or your lifestyle 100%. And I would say that most people who have success in managing their diabetes or even reversing it, they take a more moderate approach to their lifestyle changes. So what that means is that cutting back on carbohydrates and specifically added sugars are going to have you're going to have an improvement in your blood sugar and your diabetes control, but by no means do you have to eliminate carbohydrates or even sugar completely to control or to reverse your diabetes. I'm going to give you a bonus here of some things that you can do to optimize your blood sugar and your metabolic health when you do eat carbohydrates. Number 1, you want to really focus on whole food sources. You're going to be wanting to look for fruits and vegetables, nuts and seeds, whole grains. You're wanting to avoid processed foods such as breads, pastries, desserts. You want to look at labels and avoid or limit anything with added sugars, or choose options that have lower amounts of added sugars. And if you're looking at that label, you're wanting to get the most fiber possible. And the caveat, you do want to slowly increase your fiber over time or else it'll cause upset stomach. But most of us are needing to increase our fiber amount. And I have other videos that talk about that, and I'll link below. But fiber is a carbohydrate, and it's really important for our health. So we're wanting to increase fiber, decrease added sugars, but by no means do you need to cut them out 100%. If you are eating carbohydrates and added sugars, a great tip is that you eat those last in your meal. Ideally, you're eating your vegetables and your protein first, and then you have your carbohydrate. So the traditional having a salad before dinner is super helpful to help control your blood sugar. If you're not having a full meal and you're wanting to have some carbohydrates, then even mixing it with the protein and fat and fiber will help keep your blood sugar stable long term. Another tip that you can use is Be physically active after eating carbohydrates. And you can do this by exercising, but it can also be as simple as going on a short walk, cleaning the house, playing with your kids, dancing. Just moving your body after meals can help lower that blood sugar that typically goes up after meals. Last, working with a health professional, a dietitian, or a diabetes coach can be super helpful to determine what is best for your particular situation. And of course, if you live in Missouri, I would love to help you at Missouri Metabolic Health. You can check out our website, MissouriMetabolicHealth.com, and schedule an appointment with me if you would like to work with me further. Myth number 3 is that once you have diabetes, you are going to have it for the rest of your life. This is not necessarily true. Many of my patients have reversed their diabetes through diet and exercise and lifestyle change. It is possible. I will say the majority of people tend to have diabetes long term, but if you have the correct guidance and you're motivated to make those changes, it is possible to reverse your diabetes. Again, work with a qualified health professional to help optimize your health and reverse diabetes if that is something that you are interested in. Myth number 4 is that type 2 diabetes only occurs in adults. Unfortunately, this is not true, and we are seeing younger and younger patients be diagnosed with type 2 diabetes. And there are many reasons for this. Of course, just our society in general has changed from being more physically active to less physically active. We tend to eat more carbohydrates, eat more added sugars. Myth number 5 is that if your blood sugar is controlled, then you don't have to worry about the complications of diabetes. And while controlling your blood sugar may help lower the risk of these complications, it is still vital importance for you to work with your doctor to screen for the complications of diabetes to make sure that they are not developing in the background. There are other factors that play a role in the development of these common complications. Complications that we typically see with diabetes include increased risks of infection, kidney disease, cardiovascular disease, stroke, heart attack, heart failure, heart disease, diabetic foot wounds. Decreased sensation in our feet can lead to a wound develop that you're not aware of, and that can worsen over time and ultimately could lead to a need for an amputation if that is unable to heal. Diabetic eye disease, so blindness may occur. So it's really important to work with your health team, get regular blood work, have your feet evaluated, see an eye doctor to have them take a look in the back of your eye and make sure that that diabetic eye disease is not developing. And if it is, that it is monitored and treated as soon as possible. The other factors that can play into the development of these complications are insulin levels. So you can have high insulin levels and a normal blood sugar, and the high insulin levels can affect these chronic conditions that can complicate diabetes. Cholesterol levels also play a role. Blood pressure definitely plays a role, so you want to have that checked ideally at least twice a year, if not more often. Family history plays a role here. Smoking is a major factor, so anybody who has diabetes and smokes cigarettes is at extremely high risk of these complications, so that is utmost importance to address. So there you have it. I helped debunk 5 common myths about type 2 diabetes. Please let me know if you learned anything, if you have any questions, if there is another thing that you've heard and you were wondering if that's a myth or if that's true. I would love to answer it, so please comment below. Subscribe, share with others so they can learn more about this chronic medical condition that impacts so many aspects of someone's health so that they can help manage it, possibly reverse it, and take control of their health to live longer and fuller lives. I can't wait to see you next week. I release new videos every Monday. Have a great week, everybody. Stay healthy out there.